My name is Kim Ducy. I'm the Partnership Manager for DocbookMD. This short presentation will give you an idea of how DocBook is being used and how we send HIPAA secure messaging. If you need a more in-depth look at the presentation, please feel free to reach out to us directly for an additional meeting. DocBook's philosophy is very simple. We are a physician-centric, patient-oriented technology that is owned and run by physicians. When you look at DocBook and how it was developed, you'll notice that with all of our features that we release, everything is with the physician in mind. So because we were founded by two physicians, they are always thinking about how physicians communicate and what will be better for them in terms of patient care. When you look at the app, we do offer a HIPAA secure messaging platform. We use 256-bit encryption. DocBook allows you to attach images to your messages, such as x-rays, EKGs, discharge summaries. Maybe you'd want to take a picture of a wound or paperwork of some sort. The messages are archived for 10 years, and you can request those messages from DocBook. And no protected health information is stored on the device. So, for example, if you lose your phone or it's stolen, we can remotely disable the app so there's no trace of it on your device. DocBook works on the iPhone, the iPad, Android phones, and Android tablets, and you can have it on up to 2 devices. Let's take a quick look at the app itself. You'll see here on the left-hand side is our menu bar. Obviously, you have HIPAA secure messaging capabilities. You also have easy access to a physician directory, so you can find a physician two ways, either by their last name under physicians, or you can find them under specialty. You can also tag physicians, specialties, care team members, and pharmacies as favorites. So think of this as kind of like a speed dial for the app. In addition to communicating physician to physician, now physicians are allowed to invite or share with their care team or their staff. This will allow physicians to build their own directory of their staff through care team. In addition to communicating with your care teams, a number of groups and hospitals have chosen to tag or brand their physicians within the app. This will be found under physician groups. This is a great way for physicians to keep referrals in network and to have an internal directory so that there's one place to go to find all of those physicians. In addition to that, we do provide a list or a directory of local pharmacies. Pharmacies can be searched for by city, zip code, a specific address, or even the name of the pharmacy. And then at the very bottom here, you'll see settings. This is where you can go in and customize the app to turn on and off your messaging, for example, and to set up or customize a PIN to protect the app. Let's look a little more closely at care teams. So now a physician is able to invite their staff to join them to communicate on DocBook. So there's a new care team directory in the app. You'll go in and actually invite each individual care team member with their first, last name, email address, or if you have them in your contacts, you can invite them directly from your contacts. Once a care team member accepts that invitation, they will download the app on their device, and that physician will now have access to their entire care team. The key here is that the physician remains in control of the messaging capabilities. For example, let's say as a physician, you're on call one weekend. You may need to communicate with a nurse or a staff person that weekend, but not necessarily on a regular basis. In order to communicate with them, you'll have to have that messaging turned on. But let's say that during the week you don't necessarily need to communicate with that person. You can turn off that messaging capability. So now the physician is in complete control as to who gets to communicate with them. Note that physicians can still communicate with other physicians as well as their own care team members. But care team members can only communicate with other care team members on that team, as well as the physician that invited them. Some additional features that DocBook offers are critical value reporting. Think of this as like your stat reporting. So if a physician is waiting for lab results, test results, maybe they're waiting for an x-ray or a film, they can receive a stat message through DocBook on their critical value reporting. We will just essentially include a software piece onto a physician's existing PAC system, physician or facility. So basically, this is a way for physicians to get that stat reporting quickly as a DocBook message. In addition to that, a number of physicians have chosen to receive their answering service messages as a DocBook message. In order to do that, DocBook will have to coordinate with that existing answering service. Now the physician will receive one place, one message, and they'll understand that it is critical or in a timely manner, they'll need to answer that. So if you do have questions about that, further questions, we can talk through that in more detail. In addition to that, we offer one-way messaging. So essentially, this is a portal that will, let's say a care team member doesn't necessarily have a remote device. This is a great way for that person to go into a web portal and actually send a one-way message to a physician or to other care team members. And in addition to that, we do offer that internal directory under physician groups. So this is the opportunity for hospitals and groups to tag their physicians in the app. So that can provide a complete directory of all of the physicians within that hospital or group. So who's using DocBook? Well, you'll notice that DocBook is really being used across all specialties. Across specialties to coordinate patient care, in addition to being used among certain specialties. So, for example, an ER doctor may be coordinating patient care with a number of other specialists. This allows them to communicate across specialties, but also within a specific specialty. In addition to that, a number of private practices as well as larger groups are using DocBook to communicate. In addition to that, we actually have a number of hospitals using DocBook to communicate not only among that hospital system, but out in the community. So now physicians are not limited to their group or any proprietary system. If they are using DocBook, they can use that to communicate within the hospital system or within a group or practice, as well as with physicians outside in the community. In addition to that, we also provide services for home health care. So this is now a great way for physicians to coordinate patient care outside of just a hospital or group. So this kind of gives you a perfect example of how DocBook can really coordinate patient care. So in this particular scenario, the ER doctor sees a patient that comes in obviously with a broken bone. So that ER doctor takes a picture of the x-ray and sends that to the orthopedist for a consult. But in addition to that, this ER doctor notices that this patient is having a regular or irregular heartbeat. What they've done is they've taken a picture of the EKG and now they're coordinating patient care with not only the orthopedist, but with the cardiologist. So, this is a perfect example of how physicians can communicate across the different channels and across the different specialties. In addition to this, now the physician has the capability of communicating with their staff through this. So, this is a great way to communicate across the different channels and also within your same specialty. So this concludes our presentation. If you need more information, please feel free to go to our website at DocbookMD.com. There's a section on there that have videos of our founders kind of explaining the philosophy and how they came about DocBook and communicating in a HIPAA secure manner. In addition to that, if you need any support at any time regarding the app and getting set up on the app and using it, please feel free to reach out to our support line at info@docbookmd.com, or you can call our toll-free number. I've also included my contact information. If you are looking at this solution and you would like to have a more in-depth presentation, feel free to email me at kim@docbookmd.com, or you can reach me on my cell phone. Thank you.